Hi, everyone. Glad to see you here. I think we'll probably have a few more people joining us. Yep, we do. And we've got Trish Welter with us today, who's going to talk about the student wellness programs at Iowa. Trish is a native of Western Iowa. She got her BS at Iowa in health and sports and her master's in public health, also at Iowa. She's currently the Associate Director of Student Wellness at Iowa and has been for the last 5.5 years. The mission of her organization is to support student success by promoting sustainable health behaviors and fostering a culture of wellness. And we welcome you, Trish. Thank you.
Thank you all so much for having me. I'm going to share my screen. Yeah, I'm here from Student Wellness at the university, and I'm going to be talking about mental health on campus and a lot of resources that are available to University of Iowa students. So appreciate the invite and happy to be here with you all. I'm first going to just touch on a little bit of data, kind of what do we know about the mental health needs of our university students. And then I'm going to talk a lot about resources and specifically some resources within the Division of Student Life, which student wellness is under. I'll talk about student wellness since that's where I'm from, but also touch on some other services like counseling service, the recovery program, student health, the Women's Center, student care and assistance, and then some other campus resources. And then at the very end, I'm going to kind of go a little bit more broad and talk about university initiatives because there have been some changes in the last year or so related to our strategic planning process that will hopefully impact mental health in a positive way going forward. So I'm briefly going to talk about the National College Health Assessment first here. This is a survey that we administer to students on campus every couple of years. We last administered it in 2021. It's a really long survey. It asks about a lot of different health things, but there's a really large mental health section on the survey. And then things about physical health, healthcare utilization, campus culture, things that impact academics, all kinds of different things. So it helps us kind of identify what are the needs of our students. And I'm sharing data from 2021 here today because that's the most recent we have. But the major caveat with that is that in 2021, it was a pretty abnormal time with COVID. A lot of our students were at home or taking classes only online. So take that with a grain of salt. We are administering the 2023 survey starting next Monday. So I'll have 2023 numbers this summer. If anyone's as much of a data nerd as me, I'd be happy to share. But one of the great things about this new survey is that we have some campus culture measures. So things like feeling of belonging on campus, feeling like the university supports health and well-being, having an open campus climate, or feeling like we as a campus look out for each other. And those are all things that really can impact mental health and ability to seek services on campus or off. So really things that we're looking at for bigger picture types of metrics. So here's just some examples of that. These questions are really new in 2021, so we'll kind of see how they change over time. But I think some of them look kind of promising, but I think we have a lot of work to do in this area. We really want students to feel that belonging. We want them to feel like as a campus, we care a lot about health and well-being because we do. And we want them to feel like their fellow students and faculty and staff really care about their success as a student. And we also look at academic impediments, so things that cause the students to drop a class or to have a lower grade in a course or part of a course. And you can see that the top 5 here are pretty related to mental health. And I should say the survey asked at least 30 of these academic impediments. So stress, anxiety, depression, those are really impacting student success in the classroom. So really important things that we need to be addressing. We also look at mental health conditions. If a student's reported being diagnosed or treated with a mental health condition in their lifetime, and a big chunk of our students have. So over a third of our students reported having one or more mental health conditions. We look at psychological distress as well. So kind of how are students feeling in the moment. We use a scale called the Kessler-6. You can see kind of right here in the middle, over half of our students as a whole are experiencing moderate distress according to that scale. And a big chunk are also experiencing serious distress. So things that we're kind of looking at, but demonstrate the need for services for our students. And then we have a lot of other measures on this survey too. One is flourishing. We also ask about resilience. So there's definitely some positive things that we've learned from the survey too. So a lot of our students report leading purposeful lives, having good relationships, feeling engaged and interested in their activities, feeling optimistic about the future, feeling like people respect them. So a lot of positive notes from the survey too. I didn't want to just kind of focus on the need, but a lot of our students report flourishing, they report being resilient. And with the times we're living in, like that's really required some resilience and bouncing back. So things that we're looking at as well. So that's just a little bit about data or kind of some metrics to kind of ground what I'm going to talk about today. But I'm mostly going to be focusing on resources on campus, specifically resources for students. So I'm from Student Wellness. We're kind of like a health promotion agency for students on campus. We offer a wide variety of health promotion or wellness or well-being services for students. And one of our main services for students is consultations. So we meet one-on-one with students to help them with their goals. So we offer consultations on stress management, sleep, nutrition, fitness, substance use, and wellness coaching. And we have 8 professional staff on our team, and we have specialists in each of these areas. So for example, if a student is meeting with us for nutrition, they'll be meeting with our registered dietitian. Or for fitness, we have a fitness specialist. We also have 2 certified alcohol and drug counselors on our team. So we have kind of specialists in each of these areas. We really tailor our appointments to our student needs. So if a student really wants to focus on a specific component of stress management or a specific component of nutrition, we're happy to address those needs. We realize not everyone has the same goals, and we really want to meet them where they're at. But all of our consultations and our services, all of our consultations when a student wants to come in for services, I should say, are free of charge for university students. So they can see these professionals, meet one-on-one for free and unlimited during their time in Iowa. So we really want to help them have healthy lifestyles and support changes in the long term. I should also mention we used to only see students in person. We have offices on the west and east side of the river on campus. But in the pandemic, we started offering Zoom appointments, and we continue to see Zoom appointments now. So that's an option. Students can choose in person or via Zoom. And I cannot see the chat without pulling it up for everyone. So if there are any questions, feel free to interrupt me. I'd be happy to go along. I forgot to mention that.
Well, I see one question which says,
Great.
just ask where you are located, and you've just answered that.
Oh,
So,
okay, great. Thank you.
maybe you could be more specific in a particular building, Liz.
Yeah, yep. Great question. So yep, this top right picture is Westlawn. We're in the Westlawn building. It's kind of by the nursing building in the medical campus. That's our main location. And then we also have a couple of offices in the Campus Recreation and Wellness Center downtown by the library. A beautiful like glass building on Burlington. So we have offices there. Great. In the future, I think we'll be in the IMU. There, you might have seen in the news, they just approved a well-being center in the Iowa Memorial Union. So at some point we'll be a move-in. But for now, that's our 2 locations for the tech assistants. Within student wellness, so again, we see a lot of appointments, but we know that not every student's got to come in for an appointment or want that service. So we do try to meet their needs in other ways. One thing that we have related to mental health is we have a sleep program for students, something that they can do from home. We really know that sleep impacts mental health quite a bit. So we have a program called Refresh for that. There is an email version of the program where we can email them once a week and they can work on their sleep and track their sleep and things like that. But we also have a sleep app that we partner with a company for that provides students with like personalized feedback on the app, and it's pictured here. So this is the Rise app. It's something in the digital space anyone could pay for, but for our students, it is free. So through us, they can get that app for free, and it tracks their sleep debt. It gives them some sleep education. It kind of shows them how their energy levels vary based on how much sleep they're given, or even throughout the day, like when are their peak times for energy, like when might be a good time to study based on their sleep habits. So it's a pretty brief program, but something that our students have really enjoyed. We just pilot tested it in the fall, and we're rolling it out now. I think we've had it out for about a month or so, but something that we can offer for students that they don't have to come in for. We also have a light therapy program. And this is something we started offering about 5 or 6 years ago in collaboration with our undergraduate student government and also University Counseling Service. And we have about 100 of those light boxes, which are pictured here. It's winter, it's cold, it's dark, and these light boxes can help with seasonal affective disorder symptoms, and students can check them out for free for a month. And sometimes if we have extras, which again, we have over 100, so often we have extras, students could check them out for longer than that if they would like. But we've shown that students who participated in the program have reduced their depression symptoms. So it's just something that they can do in addition to therapy or other things for mental health, but from the comfort of their own. And then we do a lot of workshops in student wellness as well. We started offering in April of 2020 some Karoo mindfulness workshops, which is an evidence-based program out of Duke University. It's a mindfulness and stress reduction workshop specific to college students. We have a 4-week basic workshop that we offer several times a year. We have an advanced workshop, which is for 4 weeks as well. And then we have some mindfulness retreats, which are 3-hour meditation retreats for students too. And that's been really great. We have 6 of our 8 staff are certified mindfulness instructors. So quite a lot of our team leads mindfulness. And this is really something we've seen an uptick in as the years have gone on. And a lot of new students even come in and their experience with mindfulness and interested in mindfulness, which is different than I think 5 or 10 years ago. So it's really great to see. And then we do other workshops too. We have an intuitive eating workshop, which helps students develop a healthier relationship with food and exercise. A lot of our students kind of come in and they're on the diet cycle. You know, they'll restrict their intake and then they'll overeat, then they'll feel guilty, and it's not necessarily the healthiest cycle. So we want to help them develop that healthy relationship with food and exercise and their bodies. And intuitive eating is a great approach for that. And then we do other workshops by request. We go into sororities and fraternities, residence halls, classes, or other student organizations, and we present on kind of whatever topic they ask us. So stress, substance use, sexual health, nutrition. Really kind of like our appointments are tailored to the group and what they're looking for. That's a little bit about our team and kind of what we offer related to mental health for students. I want to touch on some other campus resources. Pretty familiar with these. They're within the Division of Student Life, like Student Wellness. But I want to just throw out there, I don't work for these agencies. So if you have specific questions, I might have to refer you elsewhere. But probably the primary agency for mental health for our students on campus is University Counseling Service. And they're a really great resource for students. They offer a wide range of services related to mental health. They offer individual therapy for students. And I should say all of their services are free. So they offer one-on-one therapy with their counselors. They have locations in West Lawn like us. They have a location at the Old Capitol Mall. They have some embedded locations. So they're in a residence hall. Some of the colleges have an embedded counselor for students in that college. So like the College of Business, the College of Law, the College of Dentistry, they all have a counselor specific to that college that students can see within their academic building if they'd like. I should say that individual therapy through counseling service is offered on a brief model. So if a student is really looking for like a long-term therapy or therapist to see during their time here on campus, University Counseling Service might not be the best fit, but they also have a really great case management team, and they can help get students connected to resources in the community if long-term therapy is the best option for them. UCS also offers relationship therapy, or sometimes known as like couples counseling. And sometimes it is like therapy with two people who are in a like romantic relationship, but it can also be other types of relationships too. So things like roommates, if they're having conflict, University Counseling Service provides an option for that. And then they provide group therapy too, which we know is really beneficial. You know, students, they take classes as a group, they socialize in groups, they will work in groups or teams. And group therapy is just kind of another option for students to get that in a different setting than one-on-one. There's a lot of different groups. So there's some general therapy groups, but there's also specific groups. There's like a graduate and professional student group therapy, or there's an anxiety group. Varies a little bit each semester what those groups are, but different options to get students connected into that. And the group therapy option is available for students during their whole time here, so they can do that semester to semester if they would like. It's not necessarily on the brief model like the individual therapy is. And then University Counseling Service also offers a program called Let's Talk Hawks, which is like a drop-in confidential time where students can talk to a counselor. It's anonymous. So not necessarily as formalized as an individual therapy appointment, but a good way for students to connect in a short time frame and see a counselor that way. And then like student wellness, University Counseling Service offers a lot of workshops on campus for students. They do a lot of presentations and workshops for groups, and then they offer some workshops that any student can sign up for. Just some examples of things they're offering this semester. They have a workshop called the Anxiety Toolbox, Distress Tolerance Workshop, and a Getting Unstuck workshop. So lots of options for students to get connected here, either in a one-on-one setting or a group setting. The university also has a collegiate recovery program, and this is newer in the last 5 or 10 years or so. This is an effort that's co-led by our department in student wellness and then also University Counseling Service. It's really to provide support to students who are in recovery from substances. It might not be a huge population on our campus, but we recognize that this can be a tough campus to be on for students who are in recovery because alcohol and substance use is kind of ingrained in the culture. We really want to provide support to those students. So through the CRP, we have some different support groups. There's a mindful recovery support group for students in recovery. There's a success, not excess support group for students who may not be in recovery, but maybe just want to be making changes to their substance use. In the spring, they have a connection and resilience workshop. And then we're really excited in April of this year, we'll be offering several recovery ally trainings to faculty, staff, and students. So really want to increase the amount of people on campus who are trained to help folks in recovery and provide them with support that they might be needing during their time here on campus. A couple of other departments within the Division of Student Life that really focus on mental health supports. One is student health. So student health is also located in West Lawn. So like student wellness and University Counseling Service, they are kind of like a medical clinic for students. So they have like doctors and nurses, and they provide all the normal medical things. They're really tailored to college student needs.
Speakers.
Oh, question? Is there a question? No. Okay. Sorry. So they're like a primary health care clinic tailored to college student needs. So they're really experts in college health. One of their services is psychiatry. So they offer kind of the normal doctor's office stuff, but they also have a psychiatry team. They have 2 psychiatrists on staff. 2 psychiatry physician assistants, and then they psychiatry resource nurse as well. So they provide a lot of behavioral and medication management for students related to mental health. They work really closely with University Counseling Service as well. So oftentimes students will be seeing both, or they might see one and then go to the other. It's a really collaborative network of mental health between the 2 parties. And I should say all students pay a health fee, or most students pay a health fee as part of tuition, and that covers office visits at student health. So the psychiatry services, if the student has paid a health fee, are free during their time as a student. Another really great resource within the Division of Student Life is the Women's Resource and Action Center. And despite the name, it's not just for women, so they do offer services to others. But it's a free and confidential mental health resource for students, faculty, and staff. They do offer one-on-one counseling. They also offer advocacy for harassment, discrimination, abuse, and violence. They work with a lot of survivors of violence as well. And they have particular focus on people of color and LGBTQ populations. So that's a really great resource for many of our students as well. And their location is in the Bowman House, which is across the street from like Burge Hall, a lot of those East Side residence halls. One of the newer services is the Student Support and Crisis Line. And this is just in the last year or so. They've developed this line. They're working with community, so the county-wide crisis center, as I used to be called. They provide 24-hour support to students. So students can call in, they can chat, or they can text for mental health support or crisis support. So that's a really great addition to the resources, because a lot of the resources I've mentioned today are open during standard business hours. But this support and crisis line is really available for students 24/7. Then I wanted to just briefly mention some other resources on campus that students can seek mental health support from. The first is the Rape Victim Advocacy Program, or RVAP. This is not just for students. They serve a several county area, but they provide support to survivors of violence, sexual violence, I should say, and then also their loved ones. So their family or friends can seek their services as well. We're lucky to have a lot of other campus resources related to psychology and psychiatry. So there's a Seashore Psychology Clinic, which provides services, not just to students, but to others. There's an LGBTQ counseling clinic on campus as well, also on the east side. And then the Department of Psychiatry through the hospital provides, of course, a wide variety of psychiatry services. Again, not just for students, but it's a close option for students if that's where they'd like to seek care. There are just some other campus resources for our students. I also wanted just to mention kind of on the prevention side, or not necessarily direct service, but on the training side, suicide prevention is an area of focus on our campus. We do have a suicide prevention committee, and we do offer suicide prevention training. We have 2 programs in particular. The first is Cognito, and this is a program that is offered to students, faculty, and staff, and it really helps them identify how to kind of respond to mental health conversations in students if they come up. So if a student is experiencing these symptoms or they mention things in conversations, how might we best approach that with care and compassion and support? All incoming students take Cognitos, so they are taking this class, I guess, it's online. So they're already getting that, but then faculty and staff can opt in to take it as well. And there's a couple of different versions. There's a student version, so the program is avatar based. It has like characters, and then they can choose different scenarios. The student version has students interacting with their fellow students, friends or classmates. And then there's a faculty staff version that has faculty or staff interacting with students. So things like a professor, how would they handle things? They would have different scenarios than a student-to-student situation. But that's been a really great program for our students, faculty, and staff to help be prepared to have those conversations and know how to best support students when they bring up things like suicide. And then there's another program called Question, Persuade, and Refer. You all have probably heard of that before. QPR training. Our employee assistance program offers that for faculty and staff as well. So that's another option for kind of an in-person training for our faculty and staff. And lastly, I kind of wanted to just to zoom out a little bit. So I've talked a lot about direct services for students, but I wanted to talk briefly about kind of what's happening at the campus level. Just this past summer, our new strategic plan has started. It's a 5-year plan. We also have a fairly new president on our campus, and mental health and well-being is one of her areas of priority. So it's kind of a really exciting time to be working on this. For the first time ever, the strategic plan had holistic well-being and success mentioned in the plan. And not only is it in the plan, but it's one of 5 goals. So it's a big piece of the strategic plan. So a lot of campus efforts are going to be going to addressing this concern on our campus. Within that part of the strategic plan, there's an objective to embed well-being and mental health into all aspects of campus culture to better support our students, faculty, and staff. So again, it's an exciting time and we're really working on it. We're kind of in the stage now where we're kind of looking at what are we offering related to mental health and well-being, and then also, you know, what are some gaps, and then hopefully in the next several months we'll be identifying what are some priority areas and things that we should be working on going forward. So we really want to build that well-being and mental health aspect into our campus culture. So not just offering services to students, faculty, and staff, but thinking about like policies or systems changes or how our environments or places supportive for mental health and well-being. Really want to kind of look all across the board. What are things that we can be doing to impact this area? And then within that objective, there is a well-being and mental health campus collaborative, which a lot of leaders on campus are a part of. And then there are 6 subcommittees, and one of them is mental health and resilience. So I'm actually a co-chair of that committee with the director of the employee assistance program on our campus. So we have a team, and we're kind of specifically looking at mental health and resilience on campus for faculty, staff, and students. So I think that will inform our work going forward and what might we be able to expand and focus on in the future. That's kind of a high level view of where we're going, but just something I wanted to mention since it is an area of priority on our campus. I went through a lot of information really fast there. I wanted to ask if you have any questions. Happy to take those now.
That's pretty impressive. I don't have any questions, but it's pretty impressive. I had no idea you were doing all of that.
Yeah.
Yeah, it's pretty comprehensive. So tell me more about Cognito and how you kind of, do you see the usage getting stronger every year?
Sure. Yeah, Cognito is something we've had for several years now. We got funding, I guess, for it as part of a grant. And I say we, not me. Another unit on campus got funding to offer this program. It's a really cool program. It's avatar based, so it has like, not cartoon looking, but like people, and it takes them through real scenarios with options. Like how would you address if a student mentioned they're really struggling with their mental health, to like guide them through the scenario in a positive way that's not judgmental or not trying to push them out the door or whatever the case may be. So it's a really great program. When we started offering it, it wasn't required of anyone. So I think participation was lower. In more recent years, it became part of like the new student orientation, or not orientation, but their onboarding. So it's part of a class they take called Success at Iowa. So we're hitting thousands of students each year who are coming into the institution just because it's part of that course. So it's something that they take coming in. And that's really where we see the biggest the biggest portion of takers is those incoming students. It's a little bit harder on the faculty and staff side. I think our faculty and staff think this is an important issue, but it's just another training to take and it's not required at this point. So we've been really trying to promote that more to our faculty and staff to get them to take it to be prepared too, because certainly these things come up in the classroom, or students email in to professors or their supervisor on campus. And we really want everyone to be prepared for those conversations too.
Right.
So really trying to push it to faculty and staff at this point.
Right.
Great question.
Do they have high school versions of this?
I think it's a college solution. I guess I am not sure on that, but I can check.
I went out to the website and I see it's got every level of education. It's got a PK to 12.
Oh, great.
Higher ed. Yeah, it's pretty
That's
thorough.
Great.
So I just went out to kognito.com, and it's obviously a platform, and you buy into it as an institution. I sent the link to Jen, who is our who is in the school system.
Oh, great. Yeah.
The Iowa City school system.
Yeah, I'm biased, but I think it's a really good program, and I'm pretty familiar with what to do in these situations, but I think it's always good to have that reminder. And it's really neat. I know they do demos as well. So like if you were interested in it, you could probably experience a demo version so you could see exactly what it's like. I know I'm not giving it justice by explaining it here. I wish I had a demo video to show you or pictures or things, but it's a very, very cool program.
Yeah, they've got one on site, and I said, here, they've got a demo. It's very cool. Have you seen a rise in student suicides as we have in primary, we see it as low as elementary school now, but in high school. Have you seen the rise recently?
Yeah, at the university level, I can't say because I'm not necessarily privy to those statistics. I do know from our National College Health Assessment data, we do ask about, suicide attempts and then suicidality, or like, do they screen positive for suicide? And we have seen increases in that in the past several years. I've worked at student wellness for 12 years in different capacities. And most of the mental health indicators have just increased that whole time. I imagine when you look at the numbers of actual suicide, that is possible, but I don't know off the top of my head. Great question.
Yeah. Is the university NAMI associated with you guys at all? Have you connected with them?
I don't think so. I guess I can't say for sure that we haven't offered an educational or anything for them. I would guess they're probably connected to University Counseling Service, but not directly affiliated.
Right.
Although we would love the partnership. So if you know them, we'd be happy to work with them. There's also a really active student organization called Active Minds. And they're really focused on mental health. They work with Counseling Service a lot, and we've worked with them a bit as well. And I think there's also a new student organization called the Green Bandana Project, which is focused on mental health too, and supporting others. So that's a new one that it's on our.
Yeah, it's apparently national. Cool.
How about changes in, for instance, professional student problems, suicide? If there's a dental school, I think there was just somebody last year. Do they have people go in? If there's somebody like in the higher incidence sometimes in the dental world, but do they have services like if there's somebody in a small professional class that ends their life?
Yes, yep. So there definitely is like a response. Yeah, they do respond to incidents, and it kind of depends on where it happens. I will say, yeah, there definitely have been some incidents in professional schools, and a lot of them have their own protocols for that, and their own services. So College of Dentistry does have their own counselor through University Counseling Service, so an embedded counselor within the College of Dentistry for their students, which is great, and that's been added in recent years. The College of Law also has their own counselor too. The College of Medicine has their own counseling program separate from the Division of Student Life. So they have several staff who help with things like that. So yeah, I think they're actively engaged in those efforts. If something does happen, so how do we support students around a student who might have ended their life? Yeah, I think it just depends on where it happens, but really want to provide support to those students and reach out to those students. Thought I had a slide on student care and assistance, and I must have skipped over it, but there is also a department called Student Care and Assistance through the Division of Student Life. And they provide support to students in emergency and crisis situations too. And often when something happens on campus, they'll reach out to students who might be impacted. So for example, in Turkey and Syria, they're reaching out to students based on what's happening now to provide them with support. If they need support, they can help get them connected to the right resources. So in lots of different situations like that, natural disasters or something that might have happened to a student or student's family member, they can help provide support and get students connected. So yeah, I apologize. I had a slide on that. I just must have clicked through it on accident, but they provide a lot of good resources to general students too, if a college or something doesn't have that already for their students specifically.
Great. Any other questions, folks?
One thing I'll mention, just since that slide disappeared, the student care and assistance, we also have a food pantry for students and a clothing closet and a student emergency fund. So related to that crisis and emergency response, those are services for our students. Our food pantry, for example, has been really increasing in need in recent years. So provide a lot of support that way. Finances and mental health definitely go hand in hand too. So those are things that are areas of focus on our campus too. So sorry, I skipped that slide, but that's something that we provide support on too.
There's a lot. You've probably seen a lot of growth in your time with the group.
Yeah, which is good. It's definitely needed. I wish growth could be even more because I think there's still unmet need out there, but yeah,
Right.
services have changed and adapted to the needs for sure.
Yeah. It's certainly more than when I went to college, which was many years ago. But yeah, it's incredible how much that has changed. And the trained resources available to students. We've got a great website, and as Mary said, we've got a YouTube channel with all of our Lunch and Learns recorded, and we'll definitely be promoting this one because it's got a lot of helpful information. I know that it's sort of this mysterious place. Some of us who aren't involved with the university, we don't really know all of those things that are involved, and it's very impressive. So thank you for sharing that today, Trish.
Thank you so much.
All right. Thanks, everyone.